Much for giving me your time today.
Hi, Angie.
In a nutshell, I guess, how are we doing when it comes to women's brain health?
Well, that was one reason why we wanted to establish a day
Yeah.
to raise awareness, which we did successfully in 2019. December 2nd is now Women's Brain Health Day, and it's to raise awareness for the fact that women suffer from brain aging diseases more than men, but research historically is focused on men. So the reason that we created this day was to let people know that this inequity exists and to raise funds against it so we could do more research that better meets women's needs.
Why is the research more focused on men than, or why is it not equally looked at? Because we don't have the same brain, we don't act the same way, we're not dealing with the same issues, within our lives. So why is that?
Well, I think that's what we need to understand
Yeah.
as to why women are more susceptible. But I think historically it's, research is expensive. And the thinking is if you could study men, they don't have the hormone cycle, which make it more complex. If you could discount for the hormone cycle by studying men and applying it to women, that should be good enough. But we're now understanding that just is not the case. As you mentioned, we are very different. And because we're more susceptible, we really need to have the research understand why.
So having said that, then, the support factor, what about that? Are there enough supports available when women are looking to figure out what might be going on as they get older?
Well, supports in terms of programs that could help them stay brain healthy longer. There are a number of things our organization, for instance, is doing, one of which we also launched on December 2nd, which is a new habit tracking app called BrainFit. And the reason that this is important is it focuses on the 6 pillars of brain health. And we understand now from the science that there are certain lifestyle choices that we can make that can keep us healthy, brain healthy longer. We want our bodies and brains to go at the same time.
Yeah.
So if the research is showing that there's things that we can do, in fact, up to 40% of all cases of dementia can be avoided through your lifestyle choices. Well, that's a huge percentage. So even though we can't prevent it all, why don't we educate people about what they can do to help themselves and their loved ones stay brain healthy longer? And we're hoping that this new habit tracking app called BrainFit will help people get there.
Yeah, and it's looking at, and I was looking at it earlier before you and I are talking now, but it looks at everything from sort of your activity, your mental stress, how much sleep that you're getting, other things that you could be doing in terms of, to stimulate the brain, which is so important. Where do you feel things need to go from here? The app's now being made available, of course, but in terms of that bigger picture.
Well, we need to make sure that more research is done just generally in terms of brain aging diseases.
Right.
It's very much underfunded and even more underfunded for women. So organizations like ours are trying to, shake the cage as well as create funding opportunities for more researchers to study female brains.
Lynn, it's great to have you to talk about this. We'll
Thank
certainly
you.
be following it very closely. Lynn Posluns is the founder and CEO of the Women's Brain Health Initiative. Great to see you, Lynn.
Thanks, Angie.